Hello, my name is Jason Alley and I'm a consultant cardiac surgeon. We perform heart surgery with the aim of extending life and improving quality of life by reducing the symptoms of heart disease and heart failure with the aim of getting you back to doing the things that you love. However, heart surgery is major surgery and there are risks associated with it. There are some things that can increase the risk of complications following your heart surgery, and these are called risk factors. For some of these, there are things that we can do in advance of your surgery to make the surgery safer. These include stopping smoking, losing weight, having good control of diabetes and blood pressure, having good nutrition, and if you're anemic, controlling that in advance. And there are a range of other risk factors that we can try to control in advance. The time while you're waiting for your planned operation provides a very good opportunity for us to try to do something about these risk factors. And this is called pre-optimisation. And you'll hear more about this later from Rena. The aim of this is to reduce the risk of you experiencing complications after your surgery. We hope that you'll embrace the challenge and help us make your surgery as safe as possible.
I'm Ben Chisnell, a consultant anaesthetist here at Royal Papworth Hospital. As part of your surgery, you will need to have a general anaesthetic. If we feel that you are very high risk for surgery, one of our consultant anaesthetists will discuss this with you and make any appropriate referrals to other specialists to make sure that everything is optimised for you before your surgery. The discussion about risk also leads into something called shared decision making. We make sure that together you understand all of the risks and benefits associated with your treatment and that you are making the correct decision about your health for you. If you have any questions about risks following your surgery, one of our anaesthetic consultants will be very happy to discuss these in your pre-admission clinic appointment.
Hi, I'm Rena, clinical nurse specialist in cardiothoracics. So research has shown that modifying your lifestyles can improve your recovery and get you home sooner. The period while you're on the waiting list is an ideal time for you to do that. Pre-optimisation includes managing your weight, remaining active within your limitations, controlling your alcohol intake, managing your sleep, looking after your mental well-being. By doing this, you will improve other health conditions you may have like diabetes, blood pressure, respiratory conditions like asthma and COPD. The clinical nurse specialist team are here to support you do this.
Hello, my name's Carol and I'm one of the dietitians covering the surgical wards.
And my name's Jo, I'm the dietitian for cardiac rehab. Before surgery, your body needs to be in the best possible shape it can be to cope with the operation and to heal afterwards. Eating well provides the nutrients that you need, like protein and vitamins and minerals, to help repair tissues, fight infection and boost energy. Being a healthy weight can help reduce your risk of complications. If you're overweight, even losing a little bit of weight can really help to put less of a strain on your heart and lungs, improve diabetic control and reduce the risk of blood clots. On the other hand, if you're underweight or malnourished, that can reduce muscle strength and delay your recovery. Staying hydrated is also really important. It helps to keep your blood pressure and circulation stable and also keeps your organs and tissues and skin in peak condition. By focusing on a healthy balanced diet filled with fruit and vegetables, lean protein, whole grains and healthy fats, you're giving yourself the best possible chance of smooth surgery with fewer complications and a faster recovery.
When you attend pre-admission clinic, you may be given carbohydrate drinks which you will be advised on how to use before surgery. Research has shown that these can improve recovery time after surgery. Your pre-admission nurse will give you more advice on these. To sum up, consider good nutrition and a healthy weight as part of your treatment.
Hello, my name is Gemma and I'm a wound care nurse. One possible risk of heart surgery is getting a wound infection. At times we see increased wound infections in patients undergoing heart bypass surgery and heart valve surgery. We monitor our infection rate so that we can continually review our practices and techniques to make sure your surgery is as safe as possible. Giving you this additional information is also part of the management of this risk, but if you do have any questions, please do speak to the team. Your surgeon will go through your specific risk factors so that you are fully informed before consenting to your surgery. The people we consider to be at a higher risk of developing a wound infection include people with diabetes, people with a BMI higher than 25, and people with both diabetes and a high BMI. More information will be given to you at your pre-admission appointment, where you will be given a leaflet called Preventing Surgical Site Infections.
Hi, I'm Katie. I'm one of the diabetes specialist nurses. If you have diabetes, we want you to feel as well prepared as possible before you come in for your surgery. Having blood sugars in a healthy range can really help reduce your risk of infection and promote better wound healing after surgery. If you would normally check your blood sugars at home, we would ask that you continue to do this at least twice per day before coming into surgery. If they are above 10 millimoles per litre, we'd ask that you go and see your GP or your local diabetes team and ask for help, support and a HbA1c blood test. The HbA1c should be less than 53 millimoles per mole, and that is with no hypoglycemia, or in other words, low blood sugars. When you come into hospital, if you usually self-administer your insulin at home, we would encourage you to continue to do this while you're here with us. Our team will be here to help support and guide you should you need any help at all during your hospital admission.
Hi, I'm Emmy, and I'm part of the Treating Tobacco Dependency team, and our aim is to help you to quit smoking. People who smoke have worse outcomes, and the best way to quit is through specialized support and medication. When you're here in Papworth Hospital, we support you with medication and nicotine replacement therapy. Once you're discharged, you have access to one-to-one support from our community partners for up to 3 months. We also follow up with you for up to 1 year. We understand that you want to quit, and we know how difficult it is. We're with you every step of the way.
You may find your condition deteriorates whilst you're on the waiting list. Please see your GP promptly to assess your condition. They may want to change medications or contact us here at Royal Papworth Hospital to expedite your surgery.